Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. We are continuing with the series of neuroimaging concepts. So today we are going to talk about neuroimaging concepts part 27, hemorrhagic stroke, part 2, hypertensive hemorrhage. So today we are going to talk about hypertensive hemorrhage. Hypertensive hemorrhage. The typical cerebral hemorrhage stroke syndrome is of rapid but not instantaneous hemiplegia. So by the time course, we can to some extent differentiate these three types of stroke. One is the infarct or the thrombosis, second is embolism, and third is hemorrhage. Thrombosis takes some time to develop, though both are of sudden in onset. If you take the time onset, thrombus takes still more time for it to manifest, followed by hemorrhage, which is rapid, and then embolism, which is almost instantaneous. So less rapid is thrombosis, rapid is hemorrhage, and instantaneous, suddenly developing is embolism. So by the time course, we can to some extent say whether it is thrombosis, embolism, or hemorrhage. So the typical cerebral hemorrhage stroke syndrome is of rapid but not as instantaneous as embolism, and they usually present with headache. What is the reason for headache? We all know brain is by and large is insensitive to pain. Even if we cut brain, there is no pain. There are certain pain sensitive receptors which when get affected will present with pain or headache. So by and large, the meninges and vessels in the meninges are sensitive to pain. So generally in infarct, they don't present with headache, but hemorrhage may present with headache. The reason being that when there is hemorrhage, because there is a torrential bleed, there will be raised intracranial pressure. The pressure gets elevated because the brain is limited by overlying skull. So when there is hemorrhage, the brain tries to expand externally, but it cannot expand because there is an overlying skull. So it goes and impinges on the meninges, the vessels of the meninges, so producing pain or headache, because meninges and vessels in the meninges are pain sensitive structures. That's why when meninges get affected, we develop headache. That's why we see headache in subarachnoid hemorrhage, where the vessels rupture and the subarachnoid space, that is the meninges, get affected. Since meninges get affected by the inflammatory products, by the chemical irritants, it causes headache. And second, we again find headache in meningitis, because in meningitis there is again infection of the meninges which can affect meninges and can produce headache. And we see in migraine also, because the trigeminal complex, the meninges gets affected, the vessels get affected, and it produces headache. So headache is usually seen only when there is raised intracranial pressure or when the meninges, which are pain sensitive structures, when they get affected. So when there is headache because of the raised intracranial pressure due to hemorrhage and meninges being inflicted, there will be headache. So we see headache commonly in hypertensive hemorrhage, but not in infarction. So headache is commonly seen in hemorrhage but not in infarction. So if a person with stroke presents with headache, we have to suspect hemorrhage. Hemorrhage is more likely than infarction. And there will be acute hypertension. So hypertension is the single most important modifiable risk factor for stroke, and for hemorrhage it is the most important risk factor. So there will be acute hypertension and sometimes vomitings, and serves most dependably to distinguish hemorrhage from an ischemic stroke on clinical grounds. So very difficult to differentiate when a person presents with stroke whether it is ischemic stroke or hemorrhagic stroke, but there are certain clues. The clues being rapid onset, whereas in thrombus it is less rapid onset, Second is headache because of the raised intracranial pressure. Usually there will be acute hypertension and vomiting. So if these four factors are there, it is more in favor of hemorrhage rather than thrombosis or ischemic stroke. So very difficult to distinguish hemorrhage from an ischemic stroke on clinical grounds, but with these clues to some extent we can differentiate whether it's a hemorrhagic stroke or an ischemic stroke. But finally we confirm it by taking a CT head. So there are many risk factors as we discussed in the last episode for hemorrhage, but hypertension, I repeat, hypertension is the single most important modifiable risk factor for stroke. So hypertension is the single most important modifiable risk factor for stroke. So there are many causes of hemorrhage. So when a person presents with hemorrhage, how can we identify the cause, whether it is a hypertensive hemorrhage or it is hemorrhage due to other causes? By looking at the site. There are certain sites of hemorrhage which are highly suggestive of hypertension. So the common sites of hypertensive hemorrhage, so if we find hemorrhage in these sites, it is most of the time it is because of hypertension. So these are the common sites of hypertensive hemorrhage. The common sites are putamen, thalamus, pons and cerebellum. So these are the common sites of hypertensive bleed. So if you find bleed in putamen or thalamus or pons or cerebellum, it is suggestive of hypertensive hemorrhage. The above common sites are thought to be due to rupture of small Charcot-Bouchard microaneurysm due to hypertension. So when there is a long-standing hypertension, it results in small Charcot-Bouchard microaneurysms. So these microaneurysms may rupture and cause hemorrhage. So if you find hemorrhage in putamen, thalamus, pons and cerebellum, it is usually due to hypertensive bleed and it is thought to be due to rupture of small Charcot-Bouchard microaneurysms. So as I said, these are the common sites of hypertensive bleed. So this is the most common site of hypertensive bleed. So this is the basal ganglia or putamen bleed. So this is the most common site of the hypertensive bleed. This is the basal ganglia or putamen. Then we have the bleed in the thalamus. So if there's a bleed in thalamus or hemorrhage in thalamus, again we have to suspect it as a hypertensive hemorrhage. Easy to identify thalamus is just follow the third ventricle. By the side of the third ventricle lies the thalamus. So if there's a bleed in the thalamus area, it is again suggestive of hypertensive bleed. And the other common site of hypertensive bleed is the pons. So this is a pons. So if you find bleed in the pons, again it is suggestive of hypertensive bleed. And other common site is the cerebellum. So if you find here, this is the cerebellum. So if you find bleed in the cerebellum, again it is suggestive of hypertensive hemorrhage. So these are the common sites of the hypertensive hemorrhage. One is the putamen, second is the thalamus, third is the pons and fourth is the cerebellum. Of all these sites, the putamen is the most common site of hypertensive bleed. So if you find bleed in these four areas, we have to suspect that it is a hypertensive bleed. I hope you have enjoyed listening to these wonderful concepts of hypertensive bleed. The other important concepts of clinical neurology I have put in a book called Exam Oriented Clinical Neurology, which will be very useful for students appearing for clinical neurology exams. So if interested, this book could be purchased. The other book I've written is Focused Neurology, Important Concepts of Neurology. I put it in a question and answer format. This book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. This book will be very useful for students appearing for oral exams. So I hope you have enjoyed listening to these wonderful concepts of hypertensive bleed. If you have enjoyed it, please like and share the link, but please subscribe my YouTube channel Dr. Sreenivas Medical Concept, which is one of the India's leading neurology educational YouTube channels, and my web page Dr. Sreenivas Concepts. Thank you.